My name is Kelsey Bauer, and I am a nurse on the Finley Acute Rehab floor. I started here as a nurse right out of college from Clark University. So on the rehab floor, I arrive here about 6:30 in the morning. I get report from the night shift nurses, and then I start my day. So I look at my patients that I'm going to be taking care of. I go in and do their physical assessment, so head to toe assessment and vitals, get them up, get them in their wheelchairs, and we usually will serve them breakfast. And then from there, we help them get to their therapies. They usually do about 2 to 3 hours of therapy a day. So they're at therapy usually until about 2 or 3 o'clock in the afternoon. And then typically we get them down for a rest after that, and they go to dinner and then usually pass some evening pills, and then our shift ends at 6:30 p.m. So from a young age, I always knew that I wanted to be a nurse. My grandma suffered a severe stroke when I was just a little girl. So I watched her struggle with that. She was placed into a skilled facility or a nursing home, and she spent the rest of her life there. So my parents and I always would visit her every day, and I just got to see the care that she received from the nurses in that nursing home, and it made me look up to them, and that's kind of what started that I wanted to be a nurse. And then my sophomore year of high school, I started dating this gentleman, which is now my husband of 8 years. So, but he got diagnosed with Hodgkin's lymphoma. So I got to see him go through that, but I also got to watch, the nurses take care of him, and that just is what really made me want to become a nurse. One thing I enjoy about this job is just seeing the progress that the patients make on this floor. So they usually are here for about 2 weeks, and just seeing them from when they first come in. Typically we get a lot of stroke patients, so whether that be they have expressive aphasia or right-sided or left-sided weakness, it is so cool to just see them progress from those, couple weeks that they're here, from not being able to do things to them walking out the door. It's just a month ago, I got nominated for the Daisy Award. It's a national nursing award, and I was recognized by one of the patients on this floor that I took care of. So I just think that that was probably one of the most meaningful things that has happened to me this far in my nursing career.